Yeah, we've had a lot of discussion about that. We do collect the Aboriginal Data Standard, it's called, for all of our communicable diseases in British Columbia, and we do for COVID-19 as well. So that is whether somebody self-identifies as being First Nations, Inuit, or Métis. And then there's some additional questions that are a standard that we ask. So we do have that information. We have not to date been collecting other race, ethnicity information, but it is something we've been discussing. We know it can be an incredibly important marker, and certainly in the United States, it's something that is routinely collected, and part of that is because of challenges around access to health care. It is something we're actively discussing. One of the areas that we are collecting that information, will continue to, is the work that we're doing in the unintended consequences of the actions that we've been taking around this pandemic. So we know that people who are underhoused, we know that people who are in lower socioeconomic status will be more affected by this crisis, both the health crises, but also the economic crises. So we want to be able to measure that. We know that that poor health is associated with things like poverty and what we call the social determinants of health. So we are very much looking at both race and social and economic status in assessing those impacts. And we're looking at how we might be able to do that in terms of the cases. It has been, as you know, there's been an evolution around this pandemic where it's been imported cases from places around the world. So it may not reflect necessarily the impact on our population, but it certainly is an important measure for us to be aware of, and we're thinking about how we can do that for sure.